This one is brought to you by Grandstone Action Together and Palmetto State Abortion Fund. My name is Ashlyn, and we have Talisa. Talisa, do you want to say hi? She is our Director of Outreach for the Palmetto State Abortion Fund. And Lorraine is watching tonight. She's our treasurer at GSAT. So we're excited to talk to these three women about what is happening and the state of things in South Carolina. So we have Patrice, and we have Hannah and Fredanna. And before we get started, I feel like I should mention that the last two live streams I did had a friend of mine, Damian Fowler, on them, and he has since passed away. He was killed last week riding his bicycle to work. So feels a little weird to be on a live stream without him when he was a big part of what we've done. So I just wanted to let everyone know that there's a GoFundMe that has been set up for his son, and his memorial service is this Friday. You can get more information about that on my Facebook or on Grandstone Action Together's Facebook. So yeah, just wanted to dampen the mood. Sorry, everybody, but that's what we're starting with. So we wanted to just let our three panelists kind of introduce themselves, and then we will get right into some experiences, some questions, and some interesting data that I have found and that my colleague Jelena has found as well and sent over, and see how that affects us here in South Carolina. So Patrice, would you like to start and just say a little bit about yourself and what you do?
Yeah, sure. Hi, everyone. My name is Patrice. I consider myself a community organizer, but I have done some organizing on campaigns. And then other than that, I also am a birth doula and a postpartum doula, as well as I've studied public health at the university setting. And let's see what else. I'm just trying to be an advocate wherever I can and reach out to the community. I do live in a military community, so I do try to help support women in postpartum care during that time.
Awesome. Thank you so much. And I don't know if you said this, but you are a new mom. You've got a cute baby boy.
I am a new mom. I always forget that because I definitely started in birth before and working around with families before I was a mom. It's changed my perspective in a lot of ways. But yeah, I'm a new mom.
Yes, and it's super amazing. He is handsome. Super, super cute.
Thank you.
So Fredanna, would you like to go next and talk to us about what you teach at Coastal and the chair, department chair of the health science or public health department, and what your specialty and your interests are?
I can definitely do that. I'm Fredanna McGough. I am the chair of the Department of Health Sciences at Coastal Carolina University. I'm also a professor in public health. My focus area is maternal and child health and women's reproductive health concerns and issues. So I'm very excited to be part of this panel. Thank you.
Thank you for joining us. Your name always comes up. I feel like Matt Wilkinson is always like, you need to talk to Fredanna. You need to talk to her. So I'm super excited that we finally been able to link up. And we also have your colleague, Hannah. Hannah, would you like to introduce yourself and what you specialize in or what your special interests are within the field of public health?
Sure. So hello, everyone. My name is Hannah Coffman. I am an assistant professor of public health at Coastal Carolina University. My research is really rooted in sexual violence and sexual experiences, both positive and negative. And I just have been working in college health and health education for, gosh, I don't even know. I'd have to do the math for a while now. So the young adult, college age population is really where my interests are rooted.
Awesome. Well, I'm glad to have you all here. I know, I don't know actually if you could tell by the couple questions that were sent over on maternal mortality. Jelena wrote those. Jelena came up with those questions for me. So I had a crazy day. So she offered to help out with some questions. And when I saw them, I'm just like, yeah, I feel like they're going to know a professor came up with these questions. But something I want to start with is what I saw. I saw this actually on Twitter, and it was that one graph that I showed you. I sent earlier to everyone's emails. It just shows how states that have more restrictive abortion laws also have worse maternal mortality rates. And I thought that was interesting. And I also just wanted to know why you think that might be, or if this is a trend worldwide. Has this always trended this way? You think people argue that it's protecting life, but I mean, not if our maternal mortality rates are going up and we're having awful anyway. So to take a stab at that one first.
I guess I'll go ahead and start off. And again, thank you so much for having us here today. I haven't been part of this this panel, discussion with GSAT, but I'm very excited to be part of that. But to start off, I think one of the main concerns is just generally that communities that actually have restrictive reproductive or abortion laws, I should say, also have restrictive reproductive laws. And so they kind of feed off of each other. So when we look at the reproductive policies that exist, accessibility to contraception, accessibility to prenatal healthcare, education about sex and sexuality, whether it's at school or in college settings or what have you, they're very restrictive as well. And so they tend to tie in together, and it may not necessarily be because of the abortion law itself, but it may be because of all the other socio-demographic factors that are occurring, and the health disparities that are existing that are contributing to this. And I don't know if anybody wants to jump in there, but that's kind of like a foundation, I would say, to start the conversation.
I think the only, you said it wonderfully, but I came from one of those communities, and that's kind of where I got started in political work, is because I thought that it was normal for women to travel an hour and a half, 2 hours to go give birth, to go get like women health care. I thought that was normal. All of my sisters, myself, we were all born in Charleston. We lived actually an hour and a half away from our home, and I thought that was normal. Until I started asking questions about the healthcare and everything. And, as I grow up and, so whenever I give birth, I'm going to travel this far away. And my mom says, I hope not. And then talked about the fear of giving birth in our county, the fear of not having the care in our county. I know we've heard so many times about the lack of OBGYN care in certain counties. We had one. So I guess we weren't that part, but I guess that's what kind of pushed me into politics and pushed me into advocacy, is because that's what I saw at 7 years old, was every woman, every person in my life, whenever it was time for them to get any type of care, they left our community.
And to follow up, it's fascinating that we're talking about this in the United States, right? And these are situations and issues that we tend to see in a lot of developing countries, and we're seeing it right here. We talk about delays, right? And in developing countries, we talk about delays to access, to even know that there's a complication, perhaps, in a pregnancy. We talk about delays to get to a facility. And what we're talking about right now with Patrice is, an hour and a half to get to a facility when you're in labor. And then we also have delays as to who's going to provide the service, you know, who's going to be available, who can and who will, you know, provide those resources. In the United States, a lot of folks may have insurance, but many people do not, you know, and not having health insurance or not having health insurance becomes a major factor as to, you know, am I going to go to the hospital? Am I going to try to figure out, you know, should I deliver at home? You know, should I get my doula, who you do have to, you know, you've got to pay your midwife, you know, and so on, but trying to figure out how you navigate those resources also become a factor. So just as we're figuring out or trying to understand, you know, the birthing process, we can also look at issues and concerns with having accessibility to abortion care, you know, and being able to access that. I mean, the closest Planned Parenthood in South Carolina is in Columbia, you know, and then the others are actually out of state, right, to be able to have those kinds of access. So even, you know, if we're talking about delivery, we're also talking about accessibility to a reproductive right, and it's just not as accessible as it needs to be. And these can be frustrating.
I think it was Williamsburg County that had one hospital at one point in time. They might still only have one hospital, which is just awful because clearly you need more than one hospital. So I guess I think that makes a good point that overall it is a lack of healthcare, which leads to more problems postpartum. I know, Patrice, you said you had some issues in the hospital. I don't know if you want to share about that, because one of the questions was about discrimination that pregnant people might face, and how that leads into problems with their health.
Yeah, so I will give a shortened version of it because I could be here all day talking about the choices, and I guess my whole like background had led me to like, I knew my choices going into it. Giving birth, not only during this day and age where I know that I'm 3 times, 4 times more likely to die. I would be lying if I say I wasn't afraid, and I internalized that. So I talked with my husband, I'd been a doula for 5 years before then at that point. I was like, okay, so we're also giving birth during a pandemic. So what are we going to do? At the time, our hospitals were overran in Colorado Springs. That's where we were. So I said, well, I'm going to hire a certified nurse midwife. The idea would be to give birth at home. If not, I would transfer to the hospital. They had a working relationship with that hospital. And so I thought through everything. I was there looking at the percentage points of what's the percentage if I die at home? What's the percentage if I die in the hospital? And I weighed that out. But even then, if I was worried about my baby, I knew I was going to the hospital to get checked. And I did that. But at the same time, I was yelled at and told that I didn't know the statistics that between dying at home versus in the hospital. I said, ma'am, I am more likely to die at your hospital than I am at home. And I knew that, and I internalized that because I've been in what propelled me into being a doula is because I sat beside my sister when she was giving birth, and I saw how the nurses talked to her, how the doctors talked down to her, didn't listen to her concerns that she knew were going on. She knew her body. She had 2 rods in her back from scoliosis. She knew her body and what she was capable of doing. And she wasn't heard of. So I was like, how can I be an advocate in this space? And so, of course, things didn't work out, didn't give birth at home. I ended up going to the hospital when we noticed some concerns with baby, and decided to give birth there. And then in that, I wasn't listened to. And I was told I was being aggressive. And I was the whole Black woman trope of, if I am not going by what my doctor is saying, then I am defying them. I was written down. And to that point, that changed my whole perspective on my visit. Yes, I welcomed my baby. That was amazing. he was healthy. I stuck to it. I didn't, like, the doctor that tried to just say, oh, I'm going to come in and give you a C-section, after not talking to me the entire time I was there, didn't talk to me about my care, didn't talk to me about anything. I just wanted a conversation. And I'm stubborn. That's how I am. I said, don't worry, I'm not having a baby on your watch anyway. And I waited her out. And I ended up giving birth, but that wasn't held because of the fact that I did ask questions. I gave all the necessary vaccines. I gave everything. I did everything, was able to deliver vaginally, everything like that. I got a visit by the social services on day 2. And at that point, I knew I needed to request my health records and see what was said. I had nurses lying in there saying that I said I wanted to check myself out. If I drove myself to the hospital, why would I be checking myself out? If every step of the way, all of it indicated that there was no distress to me, no distress to my child. Why? I was safe. I asked that every step of the way. Am I safe? Is my child safe? Are we okay to wait? Obviously it was, because y'all took me back. So, and then just continually, even like going, and I called for investigation. I knew that was something that was open to me, but every step of the way I asked, if I didn't know how to do this, how else would I have been treated? Like, if I didn't know that I could request to talk to someone, if I didn't know that I had options and how to navigate that, even then I had my own doula by me. And I had my husband, who has been learning the doula ways of things for years. If I didn't know, how would they be pushing this and being yelled at and told that I was killing my baby in this whole midst of things? I'm like, that's not right. So yeah, I could go into it forever and ever all about the investigation afterwards, but I felt it, and I didn't know if I felt it because I was more aware of it, but I felt it during my own birth experience. So yeah.
Fredanna or Hannah, do you think, what do you say about doctors and nurses not trusting their patients regarding this? It seems like women, in particular, Black women, don't get taken seriously, even sometimes by female doctors. So I don't know. How does this relate?
I was listening to Patrice, and I was thinking about my experience. And just to share, I changed my physician at 30 weeks because did not want to listen, did not want to hear what I had to say, did not take my agency into consideration, understanding that I study women's health and maternal health and maternal mortality, and this is my line of research. And yet there was a speaking down and not a conversation about things that were important. So at 30 weeks, I was getting into an argument with my physician, and my husband was like, Fredanna, we don't even have to do this. It's like, just let us know how to get your records, and we will go and find somebody else, and which is what I did. And I thought to myself, if I was spoken to in that way, I can't imagine how others were being spoken to who did not have the same level of understanding of things that could be done and they could do and their own sense of agency. I thought about a young, teenage girl who's pregnant and was just told, this is what we're going to do. You are going to have a C-section, without a conversation about, what kind of delivery do you actually want to have. The birth plan, I don't do birth plans, is what the physician said. We're not going to work with that. And going, hold on a second, this is my plan. recognizing that plans could go wrong. We know that, but at least take a look at my plan, so that you know what it is that I would like to have happen. And it was just not acknowledged, and it was not discussed. The second folks that I did end up going to did listen, and they heard me, wanting to work with a doula, wanting to work with a midwife as well, recognizing that I am in a different risk category and bracket. And so I knew that I did have to work with a physician, but people who listened. And I think that's what's really important. A lot of, there is a dismissive nature, towards women and towards Black women. And it is frustrating. And I think a part of what we see with maternal mortality is the fact that there isn't a respect of an individual that exists. And for that, I'm very vocal, when it comes to that. Listen to the individual. When they tell you something, hear what it is that they're saying. If they're talking about, pain, for example, listen about their pain. Don't dismiss it as though you are being unreasonable and you do not, and you're not following through, right? So I think it's not hearing individuals, I think is one of the biggest miscarriages that exist, right? So, I heard Patrice and I was shaking. I was like, oh dear, because your story is so similar to so many women's stories that are out there that, and then we wonder why, oh, did somebody pass away? Why did somebody die? And I'm like, well, there are all these indicators along the way that would show you, the reasons why, and yet it's not, people not being considered. They're being dismissed. Their needs and their wants are being dismissed, and that's very problematic.
Hannah, did you want to add anything to that part of the discussion?
Yeah, I think part of the problem too is that we've spent so much time in our healthcare system problematizing the female experience. So making birth a medical emergency, and this idea that our OBs are trained for emergencies and not for just what your body's supposed to do and what it knows what to do. And so there's this already heightened stress and cortisol and all of these other levels of anxiety and pressure that's going on. And I don't know how to fix that other than to, overhaul the entire medical system, but we're missing the human aspect of the birth process. And we're pushing C-sections and we're pushing drugs and we're pushing all of these things that we know are going to lead to more risk factors.
That makes absolutely total sense. I had no real control over my past pregnancy because I had twins and they were not in the proper position. They did come early. So while I had a planned C-section, it ended up being an urgent C-section because it happened before it was supposed to. Overall, the care I got during the procedure was fine. My aftercare was garbage. I was told that I was just having gas pains whenever I was having pain in my upper left quadrant. And I was in the hospital for 5 days because I guess I lost a lot of blood and they wanted to keep me an extra day. I had 2 blood transfusions. But so they sent me home. I spent 2 nights at home and then I went right back to the hospital I thought I was having a blood clot. I had postpartum preeclampsia and my blood pressure was almost at 180 over 110. It was the worst experience of my life. And I was conscious of that something was wrong with me and that something didn't feel right. And I feel like a lot of people might have overlooked their symptoms, especially when you have nurses telling you that it's just gas pains that you're having, and it's actually the rib pain with preeclampsia. So thankfully I am okay. But that was my fun experience, which I think can kind of lead into Talisa's question. When we have horrible postpartum experiences.
Yeah, so I guess listening to you all's story, it just made me think of like the mental health and like how that leads to like postpartum depression and things like that. So I don't know. I want to know if you guys had any thoughts on that and or had to deal with that.
Yeah, so I just to lead in, I was also one of those people that had to go back to the hospital for postpartum preeclampsia. I kissed my husband and my son goodbye because I told him I was dying because I had such a splitting headache, and it just wouldn't stop. I didn't know what to do, so I went back to the hospital. But I told my husband, I was like, I'm clearly dying. This is, of course, in my postpartum mind, that's what was happening. But I guess like leading into that is I have had the gracious experience to also have been a doula in Germany and been able to see how they handle postpartum, where the support is way different than what we get here. We get kicked out of the hospital. Sometimes I got kicked out 2 days after sitting home. Of course, at that point, I begged my mom to come out. It's time. But they get government funded help in the homes that get to come and help them for 6 weeks. For 6 weeks. So not only I've had moms that have given birth with, and I've been there, they've been my clients. They get asked at the hospital, hey, you think you're ready to go home, or you want to stay here a little bit longer? And then once they get home, they make sure they go to have a midwife that comes if you need help with cleaning, if you need help with baby, if you need all these checkups. But they have seen that helps reduce their mortality rates with postpartum. It helps also, they're in the house, they're able to see and flag postpartum depression. That's all different things that they have built into their system to where it's normal. Like, hey, so people are feeling like that. Oh, so when is your midwife coming? I forgot the German word for it, but when's your midwife coming? And it's accepted. And I wish I had my midwives, even though I did transfer to the hospital, they did still, like, I've had a great experience where they would come to my house. They did weight checks at home for us. They came to my house and still were able to help me out. But imagine if we had a system where 6 weeks after moms and babies were taken care of for everybody.
It's so shocking, and to think about what should have happened, right? Like, we want that German experience where people are taken care of after they give birth. And to your question about, how does that impact people's mental health? That physically, you have to think of the physical exhaustion, but most people, when they're new moms for the first time ever, if they've never had to take care of a baby in that kind of way, their entire life is turned upside down. And then you have this shift in, am I no longer a human being, or am I no longer a person? Am I just, my friend's she jokingly called herself like the grocery store, because, she was suddenly just all felt like she did in life was provide food for this infant. And that's a piece that I don't think we do a very good job of talking about, is like, you are still a human being and this individual that has thoughts and feelings and experiences. And it's not okay that we say, oh, well, you're probably just tired or getting used to it. Like, there is this shift in understanding who you are as a person, because you suddenly have these people who rely on you for everything. And that's that's a piece that goes along with that postpartum period that we just don't talk about as much.
Yeah, I see that. I feel everything seems to be connected for postpartum care with not zero. We have one checkup, 6 weeks later. And, for postpartum preeclampsia, yes, it's extremely rare. Me and Patrice are in this really exclusive club. That you might even catch. Your only symptom is blood pressure or rib pain, unless you were going to see your doctor or having your nurse come check in on you. So with that, across the entire country, we've got for postpartum care, and the abortion restrictions that are a lot worse in specific states. With higher maternal mortality rates. What do you think is, something that could happen in Congress, a piece of legislation, anything that could help these trends go in a different direction to, giving people bodily autonomy, protecting their reproductive rights and their choice to abortion, providing better maternal postpartum outcomes, and really, knowing that technology has improved greatly over the past 30 or so years, and still the rates aren't going down for maternal mortality, they are going up. So I guess it's a very loaded, long question. Feel free to take it however you want, and we'll see what we can come up with.
So the first thing I always go back to is education. So South Carolina has a policy of abstinence, generally abstinence only or abstinence plus education in schools. And a lot of our students. So I teach at the college level, and a lot of our students, you definitely see the split between students who have comprehensive sex education and those who do not. And it's and when you realize that people do not know what's available and what's accessible and is there for them, people don't know how to have safe sex, for example. Something as basic as that, providing contraception to individuals. One of the biggest, I would say one of the main ways in which we can reduce, abortions in communities and society is by preventing unwanted pregnancy. And by having unwanted pregnancies, we need to be able to provide the resources and make them freely available to individuals so that we can reduce the number of unwanted pregnancies. The problem that I have with restrictive abortion policies is that it's kind of like an umbrella over all kinds, of availability to abortion, and some people get what we'll consider unintended outcomes. So and this is such a loaded issue. So abortion, people like either, you can be pro-choice, you can be pro-abortion, you can be pro-life, and everywhere in between. But overarchingly, we want to be sure that we can reduce the number of abortions that exist, but we do not provide the resources, and we don't provide the information. We don't provide anything in some societies to be able to do that, to reduce the numbers, the overall numbers. And instead, it's like, let's go the extreme version and say, okay, we're going to have heartbeat laws and so on, or just deny abortion altogether. And we know that even if you deny abortions, people are still going to have abortions, which then increases people's risk of infections, hemorrhaging, death, disability, and all of the other elements that exist. So we can say, sure, let's just, get rid of abortion, but it's not going to be rid. It will still continue to exist. It's not going to, if a person wants to, to terminate a pregnancy and doesn't want to be pregnant anymore, they will not be pregnant anymore. However, that choice will come about. And so we've got to talk about safety first, and not look at women as literally just birthing vessels. If it's a choice to birth, yes, great, but if it's a choice not to, why do we inhibit that? Why are we restricting those opportunities? Because it will happen, but then we're going to have somebody who will die because those resources are not available. And then you have the punitive elements at the end of the day, where it's like, okay, you had an abortion. It is not, it's definitely botched and it's not a good one. Then you've got punitive consequences for having an abortion in a place where it wasn't legal or it was after the fact. So it's just spirals out of control, overarchingly. So I think that very restrictive policies and laws tend to have completely the opposite effect of what people are trying to do. If they're trying to, save people's lives, but I don't believe it actually does that.
Yeah.
If we're thinking of,
go ahead, Hannah. Sorry.
well, I was along those lines too. I mean, if we're thinking about providers and what they're restricted to do, there's no other type of service, standard healthcare service, that is restricted. There's no prescription that's as restricted. So we have people who may have wanted pregnancies but have some sort of complication and they can't have an induction abortion. And if they do, then their doctor's going to get sued and then they're going to go to jail, and all of these, like, that's very real life. And the consequences of that is often death. And if we say, mother's life in danger, well, what does that mean? Because my life would be in danger if I was forced to have a child when I wasn't ready, because I would not be able to have access to education and I wouldn't have my job and I wouldn't have all of these things. And it's become such a slippery slope. The more restrictive that we get, the more vague the laws get, and the wording becomes vague, and we're not grounded in any sort of medical science. Like, who's making these things up, making these laws, writing these things? It's not doctors or scientists or scholars. Like, I don't know who's writing them.
And
Right.
I think that's one of the reasons why the laws changed in Ireland, right? Where finally, there was a woman who was in a coma and she was pregnant, and they kept alive the fetus, and the person, the woman, was not going to recover from the injury, and but nobody could figure out what needed to happen, right? People's hands were tied. It's like the law says you've got to keep this fetus, alive, to term, right? But the host is not viable, and yet you're keeping, and they want to take, the family wants to move on and bury their daughter, and but they can't, because the law says one thing, but the individual is the individual is non-responsive. It makes things very challenging for physicians, and then it said, to be able to figure out and decipher policies and laws that are very muddied.
Right. I guess while I was listening to you guys, I just thought of like, I know for me, I don't think I took like a sex health class until I got to college. Like, I have no memory of that. So like when you have people who don't go to college and they don't have access to these educational courses, like how are they supposed to know this stuff? How do they find out unless they have to, you know, experience something and they find out like that?
I mean, in short, they don't, right? Like they don't find out. Um, it is, I always talk about, the numbers of states that require comprehensive sexuality education. There's literally 2 that require comprehensive sexuality education that's medically accurate. And that's the big, I think it's 2. I'm looking it up because it keeps changing, but not really that much. It's a very small number. I can send it to you, but we don't, right? We teach women that they have a hoo-ha, and we have women in college who are not able to identify a vulva, and we're like, well, so people don't get that education, so there is this huge gap, and women don't go, there's many women who don't go to a gynecologist until they are pregnant, because why would they go somewhere that's stigmatized that you would go here because you're having sex, and I don't want people to think that I'm having sex? Or young women who don't go to a gynecologist until after they're married, and then they find out that they have a dysplasia in their cervix because they have HPV or something like that. Like there's so many layers of that's missing in our education, people just don't get, unless they elect to take a human sexuality course, they don't get it. And it's a violation of human rights, is what it is. Like, it is not okay that we do not give children and adult people, human beings, the knowledge about their own bodies and their existence in an accurate way.
Does anybody want to add to that? I mean, it was well said.
It was. I just wanted to add, and I do apologize. I was on another meeting and I jumped on here a little late after I finished with that meeting. But I think a big part of it comes with what we're doing in terms of community education, because there are resources, like I pass billboards and it talks about options and different things, but it starts with educating your community about the various resources that are available. So maybe the schools won't talk about it, but if you have forums, if you have sororities and different other organizations that are gearing conversations and activities towards our youth, okay? And I would say start having those conversations as early as 5th grade, but, just depending on what the parent wants their child to be involved in. But if you get out there and you're educating in the community, let's use the resources, as meager as they may be sometimes, utilize those resources and get, the word out there that there are other options aside from being abstinent until you're 32 years old. And so having that conversation, those real life conversations with kids, kind of, helps the conversation be a two-way conversation, and they don't look at you like a joke. I'm just being honest, like I'm raising a 12-year-old. And if you're preaching abstinence, 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 they're going to start to look at you kind of crazy. Like, okay, my parents are saying this, but this is what everybody else is doing. And I'm a little interested in what everybody else is doing. At least if we are being the voice and our kids feel comfortable enough to come to us, you can intervene so that you don't have an unwanted or unplanned pregnancy and different things like that. So I think it's getting the word out there, like utilizing like groups like this, you know what I'm saying? And getting that voice out there so kids and parents know that there are safe places for us to get valuable information to be able to reach our kids. And sometimes your kids don't want to hear it from you either. So knowing that you're going from a trusted, that information is coming from a trusted source, that could be helpful as well, because I know my child, cringes when I want to talk to him about something, but he also knows that, my mom is going to give it to me straight. You know what I'm saying? She's not going to come with that craziness. So if your kids don't want to talk to you about it, at least having another outside source, community trusted source to talk to your kids about certain things.
And I think just from the political side of it, we got to make sure the right people are in the place so that we could put forth legislation. They could put forth legislation for everything else, blocking comprehensive education. We must put forth the people that will continue the fight. I know, just speaking from people in legislation, like they put forth legislation about financial literacy. Therefore, we can do it for anything else, and making sure that we continually fight. But if we keep on moving in the way that we move in, and especially in the South Carolina State Senate and House, we ain't gonna be in that place. They are already up against such a big wall of people. And if you've heard any of the conversations that have been happening, that's scary about the way that we're moving. So yeah, making sure we rally, do your community organizing, but we also do have to make sure that the right people are in place to do that fighting for us at multiple levels.
Yeah, that kind of leads into my next question. How can legislators argue like pro-birth talking points and force women into giving birth when we live in a state with higher than average maternal mortality rates? I'm sorry, y'all, I have a lot of dogs. They're just running through the house, but I hope you all heard me.
Can you repeat that last part again? Sorry.
Yeah, I'm sorry. So how can legislators argue pro-birth talking points and force women into giving birth when we live in a state with higher than average maternal mortality rates?
I've been privy to wonderfully sit on the floor multiple times to listen to these conversations and listen to some of the committee talks. They can't effectively argue it, I guess is the best way to say it. Like, a lot of times whenever those are brought up, it's ignored. It's been brought up by experts, the maternal mortality rates. It's been brought up about the need for access, and it's ignored over and over again. Because if you can probably go back the last few years, at least the last 4 years, every year around January, February, they argue this over and over again. This experts are brought in over and over again. The maternal mortality rates that are not improving at a substantial rate are brought up over and over again. And they stick on their pro-birth. They're not pro-life, it's pro-birth. They don't care about what happens after. So, I mean, I can't give a good conversation about it because literally they know. They've heard it multiple times. Legislation on the floor, I've heard it. So I know that they heard it. So I don't know how to, maybe you all have a better answer for that.
Just what's the priority? Is it the woman who exists and has a life and an identity and goes about and does things, or is it a fetus that cannot exist outside of a host? I mean, it's placing one life above the other, and the argument is, well, this new one that hasn't been spoiled yet gets priority, and I mean, I don't understand. It doesn't make sense. It's the argument of choosing cells over someone who is living and doing things out in the world, and probably a productive human, and that has a job and contributing to the society. So I don't think there can be a grounded argument that makes sense.
Yeah, I just think like I've just got out of college, and thinking, I'm coming into the world, and the first thing I have to deal with is like not only COVID, but like the stripping away of like potentially my rights and my healthcare, especially coming from a background where like I know people in the town I'm from aren't getting this education. So it's like it puts a lot on, I feel like, a lot of young people stress, a lot of people who are just, at home trying to educate others from their bedrooms, on TikTok and things like that. Like, I feel like social media plays a really big role when it comes to really outreach and letting women know about their health and about options and stuff. What do you guys think about like social media doctors? I don't want to call them that. I know they're doctors, but they're giving out information on social media, and some, I guess, aren't doctors, but what do you guys feel about that?
So people are going to access information where they can access it, whether it's right or it's wrong. And most of the time it's wrong. But, so I am thankful that there are some actual actual sexual health individuals who are actually providing information and trying to dismantle like a lot of this poor information that's out there. But you may not know if they are legitimate or if they are quacks. TikTok has become, oh dear, and Hannah knows more about this than I do, but regarding some of this information disinformation, misinformation that exists, right? And people take it as gospel. I will see some information and go, where would you get that? Where would you get that from? But in the absence of any information, you'll fill that void with anything. And the problem with social media is that it's so instantaneous and it's so fast and it's just so easily accessible. Back in the day, if somebody is like, oh, you don't get pregnant because, if you put like a bean between your knees or something like that, and it's like, you won't get pregnant. It's like, oh, you'll talk about that and then somebody will dismiss it. No, on social media, you can say that. And all of a sudden it's like, it's gone out to hundreds and thousands of individuals, not just one person. So I am appreciative of the individuals who come forward, who are legitimate health care providers and who are trying to fight the fight. But for one of them, there are hundreds more, that are spewing absolute just misinformation, or I should say disinformation, not even misinformation, just very, very wrong. So how do I feel about social media? I know we're on social media right now, but I think it's very problematic for work, to try to get the right information out there. So I'm appreciative of this forum because I think that this will definitely shed some light, and I'm hoping some education.
Sorry, y'all, I'm back. My computer literally crapped out and closed the Zoom, and I've never had that happen before. So I'm like, oh shit, did it just shut everything down? So I had to hurry up and look on my phone, make sure y'all were still good. But Talisa, thanks for holding it down. And Victoria, thanks for hopping in. If y'all don't know, Victoria is one of our board members for the Palmetto State Abortion Fund. And Victoria she just got her doctorate of nursing. So she is wonderful and super plugged into all of the good stuff that we're discussing right now. But I have a question that just came to me while I was listening to you guys on my phone and doing some thinking. So what do you think the connection is between barriers to abortion access and then also delaying like critical prenatal care because people cannot be seen, whether they choose to continue a pregnancy or terminate a pregnancy. How does that end up affecting their overall maternal health?
We have, unless you are actively trying to get pregnant and you're taking pregnancy tests regularly, assuming that you have a very, normal menstrual cycle and all of those other things, but say that you don't, and, all of that, most women don't find out, don't realize that they're pregnant. They think something else is wrong. And now we have, COVID. So a lot of the symptoms of they're really exhausted and they're like, oh, well, maybe I'm just sick. And then trying to get into a doctor's office, which never happens in a short amount of time, especially now when our healthcare system is strapped. And so you have more and more and more delays. Options are gone because we live in states that pull out, 6-week heartbeat bills and all sorts of things that don't make any sense medically. But then we're delaying access to prenatal care when someone's just now realizing like, oh, okay, so I'm going to birth someone now. Okay. So what do I need to do? Who do I need to call? I need to call my mom, ask her what to do. Like, do I call my regular doctor? Like, there's so many steps that go into the process of just finding out that you're actually pregnant, having that confirmation from your OBGYN or whoever you go to. That imagine being a 16-year-old and not wanting to come to terms with the fact that like you are now pregnant, you've taken 5 tests with your best friend in the bathroom, and you don't want to tell your mom, and you're just going to wait and wait and wait and keep eating what you've been eating and doing what you've been doing, and then we wonder why children are sick or they're small or there's preterm births. And it's not a safe space to even, for these young women especially, to even say, oh my gosh, I need to go see a professional. That's not a safe conversation for them to have unless they just are lucky and know someone that they can tell. All of that to say, it's no wonder it's dangerous. It's just dangerous.
So I just wanted to add, like during this time, during pandemic, not only have I given birth, but I've also lost a pregnancy. And that access to care in the beginning weeks where I knew something was wrong and trying to fight to get care. If you don't know about the military system, a lot of ways it's the system where you can be denied access for any which reasons, and fighting to get in, to be seen, to know, I know I'm losing this fetus at this time. Like, I know this is what's happening. I know I'm in pain. I've been in pain for weeks. I know this isn't right, being talked down to that. Oh, no, it's normal. It's normal mom things. You normal moms don't understand these things. No, like, I know something's wrong, and fighting for weeks and eventually writing complaints upon a complaints of like high powered. And then also like, and I had to use my privilege at the time and CC my mother's law firm on the emails in order to try to get access to care because I was repeatedly being denied. So, and even then, even after being seen, being dismissed, and yeah, I eventually ended up losing the pregnancy, but I went through this for 2 months of trying to fight them to be seen. Just, I couldn't, and like I said over and over in the talking to my husband, was I couldn't imagine being a teenager in this position and not feeling safe with your parents, not feeling safe in your community, like, and still I had the restrictions of our, at the time, TRICARE. I couldn't go see anyone else, or I knew I would be having to pay. At the time I was unemployed during a pandemic. I knew I would have to try to pay something out of pocket. Like, yeah, so that's just an experience that adds to that. Like, I couldn't imagine being someone else in that position, especially someone that didn't have the agency to go through those channels.
I would just also like to piggyback that not only do we miss vital information about the fetus, but we miss out on, as you just stated, problems that could be happening with the mother. Diabetes, gestational diabetes or uncontrolled diabetes if you get pregnant and you already were diabetic, hypertension, preeclampsia, all of those things can go undiagnosed, if you have to wait 6 to 8 weeks just before you can get in to see an OBGYN. Personal experience, I'm not pregnant, but I'm trying to get in to see my GYN, and my appointment has been pushed back since November. So I can only imagine, certain things, maybe they would push me higher up on the hierarchy if I was pregnant. But I guess because if I'm, and thankfully I'm not having any GYN problems, I'm just going for my annual, but it doesn't seem like they put you up much higher if there's something going on, if there's a problem. So not only do you risk the low birth weight, missing timeliness for, testing, fetal testing to make sure the baby is okay, but you miss prime opportunities for where you can identify things that are going on with mom, and you're not, like you said, if you're not actively trying to get pregnant, usually, you're not checking for things like that. And so by the time you find out, me as a grown adult, I may have time to process that, but the consistency thing that I'm hearing across the board is we're trying to reach people who may not be in situations where we are at. So how do we make it a safe space for these young ladies or these young women to come forth and feel like they're in a safe haven to where they can receive the care that they need? Like, what is it that we need to do? What messages do we need to send out there so that they can feel okay with coming forth and not waiting until the last minute and then ultimately causing more harm than good? You know what I mean?
Yeah, and that is, I think, part of the really, really big problem with this so-called heartbeat bill is you do not know that you're pregnant unless you are actively trying and checking. My first pregnancy, I found out I was pregnant right around 6 weeks. That's literally the cutoff for when they want you to be able to terminate. You don't know until it's too late almost if these bills become law. And, we have 2 bills that are in committee right now. One of them is a trigger ban where if, SCOTUS overturns Roe v. Wade, abortion will be banned in South Carolina immediately. The other one is a medical misinformation bill where they would be requiring doctors to tell their patients that they can reverse their medication abortion. And this is just not the case. There was one study I don't know how many years ago, but a while ago, and they couldn't even continue the study because it was so dangerous on the participants to just, not to stop taking the medication to cause an abortion and then try to reverse it. So having providers have to lie to their patients is just going to probably up the maternal mortality rate. I just don't see how we are, even discussing that specific bill, like straight up lying to people. When I was trying to get pregnant with my twins, I was checking and checking and checking. So like Hannah said, I was actively, looking and taking tests, and I knew right away when I was pregnant. But once again, that's people who are trying to get pregnant. If you are restricting their choice to continue a pregnancy or terminate a pregnancy and forcing them into these situations that are not going to be ideal if they know it's not going to be good for them. I just think about, what about the people who may have some health issues or maybe even have like mental health issues, take medication that is not supposedly not compatible with pregnancy, and then you're not giving them an option to do what they want with themselves. I don't know if anyone has any thoughts on that. And then the last thing I want to discuss, I will bring up after. I feel like Patrice wants to say something.
No, I'm just laughing because my mom was telling me about how like flabbergasted she was that this was actually being brought up on the Senate floor. But like, she just couldn't, she was like, but no. So I was just laughing and just like the ridiculous of it. Like, it's what?
Hannah.
I mean, that is medical malpractice. Just, I mean, to it, like, that's just what that is. And so then, our concern too is, we talked about earlier, there's an access problem. So why would anyone want to practice medicine in a state where this is how they're supported, and they know that they cannot practice as an ethical provider when they're this restricted? So why would you want to? And so then we just have this circular problem of, well, of course no one wants to practice here. Like, would you? That sounds terrible. They want you to lie to your patients, and that's morally, ethically, legally wrong. Don't do that. But also, we need to help our patients, and so we need to be there. It's just gonna wow. I don't know. Wow.
That's the overall feeling, I feel like, with this specific bill. I thought that, nothing could get worse than the Texas bounty hunter bill. And I feel like, that's bad enough. This is just like mind boggling at a different level. I don't know.
What also is like, they have testimonies that this has already been done multiple times, that they've been already trying this, and it's already been said that this is unethical. So the fact that they go on the Senate floor and they're admitting to these things, like, come on now.
Victoria, I don't know if you have any feelings about this as a professional in the medical field. How would you feel if this bill passed?
I definitely agree. You would essentially be lying to your patients by moving forward with that and causing more harm than good. And, you're supposed to do no harm. We have to make sure that we are educating our patients. And I always Deidre always laughs at me, but I always put the disclaimer out. I have my doctorate in nursing practice. Okay. I'm not a medical doctor, so I always preface with that. But I am a registered nurse and I take care of patients. So I always have to make sure that I'm educating patients on the right thing to do for health and wellness to get them back to 100%. So it's just really shocking, and like being on this side of it. So this is the most experience that I've had on this other side of the fence. And I want to be the face of a trusted medical professional. As we talked earlier, you always have to consider your source. So there's a lot of misinformation or just flat out wrong information being shared out there. And to say that now you want to take it a step further, to have trusted medical professionals now have to essentially lie, it's just very disheartening and shocking. Like, I guess that's what I'm seeing across the faces of everybody that I'm seeing, is just really shocking disbelief that this is something in 2022 that we're actually having to discuss. So we're definitely going to end up doing more harm than good, and potentially causing like irreversible damage and harm to these women. So very, very shocking, very upsetting.
Yeah, it's a bill that mostly leaves me speechless, honestly, because I have no words for how cruel it is. And like the point that Hannah made about why would you want to be a physician in the state? So we have physicians leaving, and then what? We get practices that are closing down. People can't access, regular care on top of reproductive health care. Yeah. So it feels like it's creating more problems that we already are trying to find solutions for. We discussed education being a huge part of combating all of the issues that we're facing. Investing in hospitals and not letting one county in South Carolina have one hospital. Investing in healthcare, and finally funding abortion so people can make the choice that is best for them. This would just be, I feel like, another fight that we would have to take up, as well as what we face, discrimination. If you're not a man, if you're not a cisgender man, in as a patient, you don't get taken seriously. Black women have it way worse, and medical racism plays a huge part in all of this. And that is what I wanted to end on. What do you think about combating that? How do you get rid of that structural problem within the healthcare industry?
I can start by saying, I've made my personal goal to be more active in my community about being an advocate for yourself, because I think that is the overwhelming, what we see is when you, and I'm just going to be frank with you, in the past, like, people being judged, like, okay, by the color of their skin or by their gender rather, they don't know what they're talking about, or they're not invested in their healthcare. They don't care. They're on these 2 or 3 different blood pressure medicines. And I'm just going to add another one because they don't really care. They're still going to eat what they want to eat. That overwhelming sense of, that's just the population that's just going to do what they want to do. So I've made it my goal to not only, like, not just the people in my circle, but my community, talking about ways that you advocate for yourself whenever you go to your appointments, pushing to ask the right questions, making that doctor when they, I don't know much about the billing side, but I know a little bit from when I worked on that side. But this is your time. You're going to bill me for this minimum 15-minute visit or this 10-minute visit. You got to sit in here and talk to me and answer my questions. Having your list out there, writing down the questions that you want to ask your provider, coming there with a notebook, like all of those things, asking about why I'm on a certain medication, understanding what are red flags, potentially. So when I talk about just health in my community, because hypertension is, of course, the silent killer. And a lot of people have misinformation about what is a normal reading, because personal experience, they let my father leave the hospital or the doctor's appointment with a blood pressure of 178 over 110. Right. Now, my mom knows that I'm going to flip out. So she didn't call me until afterwards, because, they had a blood pressure cuff at home and he was going to take his medicine. But the fact that the nurse let him go was the concerning part. The nurse and the doctor, like, they saw the readings and knowing, hey, that's not right. Hey, you need to do something about my blood pressure. What are the next steps? But what if they didn't have a daughter that was a nurse? So what if they didn't know to go home and recheck the blood pressure, or I'm gonna go ahead and take my, that was partly his fault because he didn't take his medicine, but still knowing those red flags. So I think the big part about it is being an advocate for yourself, knowing when to speak up, knowing what questions to ask and saying, okay, this isn't right. I don't feel right. And I'm getting a second opinion, knowing that that is your right as a patient to have these concerns addressed. And I feel like when I talk to my coaching clients, they're like, well, I didn't think to ask the doctor that. When I'm a nurse and the doctor leaves the room and then the patient bombards me with questions, I'm like, well, the doctor was just in here. You didn't want to ask the doctor those questions. And no, the doctor doesn't have time. And I'm like, no, that's what you're getting billed for, to ask those questions. That's what you're here for. So I think on the forefront of it, I said all of that to say, teaching the community how to advocate for themselves. I think that's the big takeaway from that, being an advocate for yourself.
Go ahead.
To add to that as well, because we definitely want to be an advocate, and then also seeing representation, which is another portion. If we don't have representation in areas where a difference can be made, sometimes it doesn't make as big an impact, because people do feel comfortable, being able to go to providers and practitioners who, in some cases, who represent their background, their community, and the like. And so being able to provide, opportunities and resources for folks to be healthcare providers, whether or not we're talking about, nursing, health educator, public health professional, physician, places where folks can go into communities and be part of the community, but then also providing education and building trust, I think is really important. It takes me forever to find a provider, and I search and I look, because I don't want to be disappointed. And when you finally find someone, then they leave South Carolina, and then you've got to start all over again. So it's really problematic when we can't retain great providers. We can't find, and then when we do find, you can't retain. So what are we doing to be able to ensure that there are people in the community and people in our area that we can depend on, we can rely on, to provide us with the resources that we're looking for. So, and in a lot of cases, representation is a major factor in there. So I would like to see perhaps more resources going into ensuring that folks can get financial aid, or scholarships and the like, so that they can stay in South Carolina. They can stay in rural areas and be able to provide the necessary resources that we so desperately seek. So I would say that's a part of it. I wanted to mention that one of the things that I put also in the chat is a link to Healthy People 2030 objectives. And it's pretty much just, sharing information about what the objectives of the nation is, and, for different areas and how we're doing. So right now we're like a baseline. Hello. We're in threshold mode right now. But you will notice that in some of the maternal health and infant health and neonatal health, we are regressing instead of improving. And that is really concerning. And we ask ourselves why. And if you look at specific communities, you'll notice that it's worse in specific communities. So it's important to parse out this data, because we can look at it and say, oh, okay, overarchingly, we may be improving as a whole. Then when you parse it out and you look at, ethnic differences, you start realizing that no, there are communities that are actually doing a lot worse than what the majority is purporting to look like. So, why do we have Native Hawaiians having worse maternal mortality than any other group? What's going on? Again, distrust a lot of times. We talk, so poverty, distrust, and and lack of accessibility in certain areas. So all of these things are part and parcel of that. But you can start by looking at the data and then saying, okay, what do we need to do to be able to address that? So I did put a link in there. So if folks want to take a look, they can start looking at the differences.
I also, back to your original question, I think on the flip side, so we need, we've mentioned having more visibility, more people in the communities. We also need to have more accountability when complaints are filed for discrimination and malpractice. And I say this after listening to podcasts about like Dr. Death, and just learning about how slow the process is if there's an investigation, and that there's really no legal ramifications. And a lot of times it's a slap on the wrist, if that even. So not only do we need representation in our communities, but we need action and representation in these boards who are in charge of maintaining the integrity of their practice. If we don't have that, then the bad eggs are going to continue to do what they've been doing with no ramifications. It's just as bad as sexual violence. I mean, there's not a lot of ramifications for people who commit sexual violence. It's the same train. We're allowing people to get away with doing awful, terrible things with a slap on the wrist, and that's not helpful.
Well, specifically, I know in Horry County, there's a lot of our local attorneys who are on the boards of hospitals, so they can't take up a lawsuit against a hospital who might have done something wrong. And I know this because I had to find an attorney for a friend who was considering a malpractice suit. They withheld really important information from her that could have changed a lot. And I was only able to find like literally one, and he was in Florence. And from talking to other people here in Myrtle Beach, they're like, yeah, well, that's because there's relationships between some of those medical malpractice and like disability attorneys and the different hospital boards. So when we're talking about action that being held accountable, it's kind of hard to have that sometimes when everyone's kind of in bed together.
Yeah, I was snapping all around because my son was born in February 2021. My investigation that I put in was not concluded until I think the end of November is whenever it was concluded, including nurse lying, all these different things. And of course, I'm extra and sent it to every member of the board because I did a little searchy search. And also I requested that it was sent to their board of inclusion, diversity and inclusion, so that can be like flagged. But also what struck me as such interesting in my situation is one of the doctors that told me my baby was going to F and die was a Black woman. And I saw her walk in and I was like, yes, I have a Black woman. I have someone that's here for me, going to advocate. We're going to rock this out. And I could see that system definitely shaped her. And so that's how it was. But Hannah snaps all around. They need to be held accountable in ways.
Yeah. Wow. It's a lot. It's a lot talking about all the ways that people who are new parents aren't supported, don't have, the aftercare that they need or deserve. One of the questions I saw in the comments on Facebook was, how do we get this German model here, Patrice? So I mean, that would be great. I have no idea because we can't even get simple healthcare expansions passed.
So I don't know.
Right. We can't even expand Medicaid in South Carolina. Like, what are we're gonna get weekly checkups from a nurse? No.
Well, this talk has energized me in so much ways. Because following my birth trauma, I did take a step away from birth. And so this has energized me so much to get back to it, whether it be at the university level or actually taking my MCAT. It's definitely energized me. So yeah, hopefully we do have some people that are working on that and putting that into ways that we could, there's my baby, that can actually put that model into, like, I know we do have in South Carolina some nurses that do some home visits and stuff like that. And those are programs that are very small. I know Hampton County has some that's going on. Hampton County is also one of those that, the health care there is not, I don't think, does Hampton County have a hospital? I don't think so. Either Hampton County or Allendale, one of those. There are some programs happening in South Carolina to help bring nurses to people, but it's definitely not widespread. So hopefully we have, and hopefully I can now get back out there to start working on these issues.
Yeah. The best thing that I probably received, I only had one of the nurse midwives who was on my team. She's the only one that I will not trash talk, because she actually cared about me having to get readmitted to the hospital for postpartum preeclampsia. She was able to set me up with like a home monitoring blood pressure system. So like whenever I would have like crazy readings, it was supposed to like submit to wherever it was going to go, and then it would go to the doctors. And she even said, one 6-week checkup's not enough. Like, this isn't even good enough, but it's like all that we have. So if someone watching ends up with postpartum preeclampsia, you could try to ask for that. I mean, at the time I had good insurance. I don't know what that would be without good insurance. And that's another problem, is our health insurance industry prohibits people from accessing quality care. So we have an uphill battle with a million different things to tackle all at once. But I think conversations like these and learning from each other and thinking about different ways to combat these issues is a place to start. If you, haven't tuned into Planned Parenthood, South Atlantic, or REN, they have been covering the bills in the State House, and not related to healthcare or abortion at all, but if you follow the ACLU, there have been some anti-CRT bills in the State House as well. Both of those need our attention. They are coming up, and with this Republican-dominated legislature, they're lucky they are, I don't know what word I was looking for, but they have everything that they need to pass their horrific agenda. So we just have to keep on moving and keep fighting for these issues, making sure everyone has access to reproductive care that they deserve. They have access to abortion care that they might choose, and without stigma, with support, fully funded, all of what we desire for our future. I guess if you had to, close out with one policy that you would like for the United States to change in the aspect of healthcare, maternal healthcare, reproductive healthcare, what would you like to see done first? And we will end on a slightly happier note.
For me, it's comprehensive sex education all day, and making sure that we have it. So
that is like the foundation. I feel like that is the foundation.
I'm going to say universal health care, because abortion is healthcare. So
I would love to see into law that there is a mandatory long period of time, like a year, 2 years of paid parental care, parental leave, like do whatever, whoever needs to do it, everyone needs to do it, whatever. You keep your job, you can continue to get paid and not have to use all of your vacation time. We got to have it. We got to have it. People need it.
Absolutely. Anyone else who's watching on the Zoom, feel free to say what you would like to have happen, because maybe your answer is different from our panelists. Talisa, you got any ideas?
I'm with the comprehensive sex education. I'm on that train, definitely.
I don't know if the ones without the cameras on are able to speak, but Lisa or Claire, do you either of you have a favorite policy that you think would be a good place to start, or has your answer already been taken?
Hi, I'm Lisa. I actually just joined the Women's Rights and Empowerment Network just about a month and a half ago. I've been in South Carolina about 2 years, but prior to that, I was actually in Hawaii for 11 years. And I worked at a community health center for a few years on the Big Island. I worked at Planned Parenthood on Honolulu, on Oahu. So I'm excited to be with Ren here in South Carolina and learning a lot about the state and all of its interesting policies and challenges, but some of also the positives too. I really, sex ed and medically accurate information that providers, actually can offer patients, and of course, accurate information for students and families and is important too. But I think, ultimately universal health care that includes abortion and all reproductive care in that is essential as well. I mean, there's so many layers to it, but, some of the barriers, are like religion and other things that even if you had sex ed or access to healthcare, there's always these other layers that sometimes impede these aspirations, if you will. So we have a lot of challenges ahead of us. But if you do ever have the opportunity to listen to some of the testimonials, February 17th, next week, the abortion bills will be probably on testimony, and you'll be surprised who testifies, because there are professionals, a lot of people from the pregnancy centers that are, against the types of things that we're seeking, so it's difficult sometimes to watch the folks giving testimony, to be honest, but it's an eye opener to who really signs up and what the politicians actually listen to. So yeah, we all need to fight this and really get out and vote, and that's where it all starts, is ensuring, like you guys said earlier, people that are in place to make these laws are the people that we want in there that meet our needs. So
I was going to definitely say either of the things that Hannah, Fredanna, or Talisa mentioned, or Patrice, I'm sorry. Universal healthcare is definitely a necessity. Proper sex education would solve so many problems. I'm losing the third one off the top of my head right now, but I thought it was really good. I'm sorry. But I guess I would add, accountability, honestly. Accountability as far as those who distribute misinformation and disinformation, and kind of finding a way to push our voices past theirs and advocate for our communities and things like that.
Yes, getting trust back, I think is key. And we did a live in the past on like conspiracy theories with a couple of sociologists and social psychologists, and I made the comment that I don't think Fauci should be like the person speaking, because he has been just very politicized at this point. Like no one's gonna receive him well, unfortunately. He is an expert, but what I have found encouraging is some of the infectious disease researchers and epidemiologists who are like putting out information and combating it like after hours, online. They're like, no, this person is telling lies, So if there was a way that we could win back trust and hold people accountable for spreading lies that are getting people killed, separate from the issue, obviously, of what kind of healthcare policies, they're all fantastic. Universal healthcare would be great because it encompasses so much, including what I would hope would be postpartum appointments. But I got to go with, I think, the paid parental leave, just because it's really rough and we don't support new parents at all. So having that, I feel like we would see a lower number of mental health issues, postpartum anxiety, postpartum depression, and people would be able to bond with their babies more than, what they get when they have 6 weeks of leave. That's it. If that. Some people don't get any. But just to wrap this up, thank you all for being with us. If anyone wants to watch the replay, it is on Facebook and Twitter and YouTube. This is just one of a few discussions we've been having on abortion and reproductive health care. So I'm super thrilled to have our 3 panelists who are amazing. You guys are a wealth of knowledge. Thank you for sharing it with us. And until next time, have a good night, everybody.